السلام عليكم ورحمة الله وبركاته. هذا حيكون الجزء الأخير من المحاضرة الثامنة. حيكون part 8 of part 3 of lecture 8. Okay, and as we said earlier, we are going to talk about miscellaneous anti-cancer agents in this lecture. Okay, now let's talk about some synthetic agents. Okay, example on those is the thalidomide. I think all of you know the thalidomide, or at least you heard about the thalidomide. Thalidomide was originally marketed as a safe, non-toxic sedative and anti-emetic in the 1950s. So approximately 70 years ago. Okay. And it was thought at the beginning that thalidomide was safe. Okay. That's why they gave thalidomide to treat motion sickness in pregnant women. But at that time, an increased cases of babies with some developmental deformities. Okay, those babies were suffering from teratogenic effect of the thalidomide. But the problem is that, as we said, they thought that thalidomide was safe, non-toxic. Okay, so they didn't think that those deformities are due thalidomide or because of thalidomide. All right, and by the time when they discovered that those teratogenic effects were due to or resulted from the thalidomide toxicities, approximately 8,000 to 12,000 babies were affected. They were born with deformities. They called them thalidomide babies. Okay, and that's why thalidomide was stopped. Nobody was using it, and even no one was testing it against any different diseases, any other diseases. Okay, when you talk about thalidomide to anyone, everybody was afraid of using it because of its teratogenic effect. Well, then, after a while, people start thinking about thalidomide again, okay? And they start testing thalidomide for other diseases other than the motion sickness, other than the early morning nausea and vomiting in pregnant women, okay? And the first approved use for thalidomide was against leprosy. I think you know what leprosy means, okay? When people saw that thalidomide has some good effects with a relatively good safety margins, they start thinking about thalidomide for other diseases. Okay, the second approval for thalidomide use was as an immunosuppressive agent for autoimmune diseases or for patients who get organ transplants, right? Because they found that thalidomide decrease the or act as immunosuppressant. All right. Thalidomide gained an attention as an anti-cancer agent because we are talking about antineoplastic agents, right? We're not talking about the antiemetics or the sedatives. Okay, so thalidomide gained an attention as anti-cancer agent when some research found that thalidomide can inhibit angiogenesis. And if you still don't know what angiogenesis mean, you have to go back and read the introduction. Anyway, let's keep going. So When they found that thalidomide can inhibit angiogenesis, they start testing thalidomide against different cancers, and it was found effective as an anti-cancer agent. And later on, some research found that its anti-cancer effect not only because it prevents angiogenesis, but they found that it increases the immune response. So earlier, or just a few seconds ago, I said it suppressed the immunity. Now, other research found that it increases the immunity. Okay, so for those agents that can either decrease or increase the immune response, depending on different circumstances, those agents called immunomodulators or immunomodulators, whatever you want to call it. Okay, so thalidomide was considered as an immunomodulators. Okay, but again, because of its teratogenic effect in the past, other agents like the lenalidomide, the Revlimid, or the pomalidomide, the Imnovid, okay, have been synthesized. Okay, these are analogs of the thalidomide with the aim of removing its teratogenic properties. Okay, both of these agents contain an amino substituent on the aromatic ring, okay, which is found to be crucial in producing a safer drug. So just one addition, they just added one group that resulted in a relatively safer drug. And Revlimid now is undergoing, it is approved. Revlimid is approved in the treatment of multiple myeloma. Other synthetic agent that has gained some interest as an anti-cancer drug is the arsenic trioxide, which is thought to promote cell suicide by targeting the cell's mitochondria, and it is undergoing clinical trials. The digralex acetate, which was approved in 2009 for the treatment of prostate cancer, they thought it acts as an antagonist of the gonadotropin releasing hormone, GRH. All right. These are the structures of the thalidomide and its analogs. You can see that it's relatively similar structures. Well, it's actually the same structures, except that the analogs have the amine groups added, while the thalidomide doesn't have the amine group. Okay, thalidomide have this carbonyl, and the pomalidomide, the Imnovid, also have this carbonyl, while the lenalidomide or the Revlimid doesn't have the carbonyl. Okay, that's the only differences. But if you look at the structures, they are all the same. All right, we talked about some miscellaneous synthetic agents. Now let's talk about the miscellaneous natural products. Okay. Example on those are the pancreatistatins, which inhibits the angiogenesis, and its phosphate prodrug shows potential as an anti-cancer drug. As I said, all of these are natural products. Studies have found that those three hydroxyl groups, the hydroxyl groups at carbon number 2, 3, and 4, 2 or 1, 2, or those, all of them are important for activity. And the phosphate prodrug is being going studies now. Why the phosphate? Because it's more soluble than the original drug. The bryostatin 1, the one that you can see in the figure here, was shown to boost the immune system and make it more effective against cancer. It makes the immune system more effective against cancer. And this is the structure for Bryostatin 1. And as we said, it's a natural product. Other examples on natural products are the dolastatin 10 and the monomethyl auristatin E, or just called the vedotin. All right, these are the structures, and these agents are undergoing clinical trials now, and these, as we said, all of these are natural products. All right. We've been talking about the synthetic agents, the natural products. Okay, so how about some proteins? Well, that might seem counterintuitive. Why? Because we are talking about protein. And we've been saying since the beginning of this course that protein easily degradable by proteases. Well, some proteins are being considered as an anti-cancer agent, like the angiostatin and the endostatin. These are two naturally occurring proteins in the body. So they are naturally occurring in the body, which inhibit the formation of new blood vessels and are being studied in cancer therapy. Of course, if you are going to administer those, you have special formulations to administer proteins. You cannot just give proteins orally, right? Okay, other examples are like the alpha interferon, which inhibits the release of growth factors, such as the vascular endothelial growth factor, VEGF. Okay. Studies have shown that cancer cells are more sensitive than normal cells to a natural death-inducing protein. It has a very catchy name, this protein. It's called tumor necrosis factor-related apoptosis-inducing ligand, or just call it TRAIL. Okay, just call it TRAIL. All right. And as the name implies, this TRAIL induces what? It induces apoptosis. And they think, or the studies suggested, that the cancer cells are more sensitive to this protein than normal cells. And now this protein is being studied in animals. It didn't reach clinical trials yet. A variety of proteins are being considered as immunostimulants. So it's not just, as we said, it's not only the inhibition. Sometimes we use the stimulants, including like the gamma interferon and aldesleukin. Okay, the aldesleukin, which is a preparation of interleukin 2. Okay, some studies suggested that some cancer cells develop mutant proteins, and those mutant proteins will not be able to do their job because they are faulty proteins. Okay, and some of those cancer cells, as studies suggested, they will not be able to synthesize the amino acid asparagine. Okay, so cancer cells relies on the asparagine from the blood supply. So scientists think that if you give the enzyme, asparaginase enzyme, okay, into the blood stream, this asparaginase enzyme will degrade the asparagine. And if it will degrade the asparagine, that will starve the cancer cells from getting the asparagine from the blood supply. So a preparation of the asparaginase enzyme that is called crisantaspase is used nowadays to treat certain cancers. Actually, it is approved in the treatment of certain cancers. Okay, and that will be it for our lecture 8. I hope we will continue with other lectures in the future. Bye-bye.